Hi, everyone. My name is Dr. Stephanie Rose, and I am the program director and an assistant professor for the Addiction Studies program here at UCA. We're going to briefly go over how to use naloxone in an event of an overdose. So I like to ask people what their experience with overdoses. Since we can't really have that discussion, I just encourage you to maybe reflect on maybe someone you've known or have surely heard about experiencing an overdose. I lost a cousin when he was 21 years old, and this was some significant time ago, about 20 years ago, before we had a lot of synthetic fentanyl around. He was smoking marijuana with a group of friends, and it was laced with fentanyl. And for whatever reason, the part of the bowl of the marijuana that he was sharing with others had fentanyl in it. And he immediately collapsed. People were afraid to call for help. And by the time they did, it was unfortunate, but there was nothing that could be done. And he was pronounced dead on arrival. We hear stories about this daily now, unfortunately, and a lot of this is due to the rise of synthetic opioids, particularly fentanyl. So we look at the Arkansas State Crime Lab overdose deaths. As you can see, they have significantly increased since 2014. We had 3, and now as of 2022, 251 overdose deaths just regarding fentanyl. You'll see that methamphetamine is really right up there. And a lot of times these are used together. People use a stimulant, usually meth, because it's most affordable, because they are trying to balance themselves out. If they're just using fentanyl all the time, they're drowsy, sleepy, may not feel well. And so a lot of times you'll see both of these substances being used together. Meth was our #1 killer prior to synthetic fentanyl being made. And so we definitely see how impactful this has been. You'll notice we still have autopsy reports pending. These numbers are actually higher in regards to overdose deaths, but what we notice is that there are certain counties, certain situations in which an overdose death may not be reported accurately. That could be due to, knowing the family, wanting to do a favor, not put a cause of death as an overdose on the death certificate. It can impact a lot of different things. And also, many times when people have an overdose, they fall forward. And so they may smother or die from another manner, but the initial cause of death was actually opioid overdose. And so Arkansas has since passed a law that all suspected overdose deaths go to the crime lab. And we'll see in this next slide here, there are certain counties that report 0 overdoses, but we know that this is not correct data because Narcan is being used in these counties, and we can just look at other data and know that it is very important to make sure that we are adequately reporting overdose deaths. This helps us to not only address the issues, but to get those resources that are needed by these counties. So our national overdose deaths were 107,477 just from August 2021 to August 2022. We're really approaching high numbers with overdose deaths in the U.S. From 99 to 2020, you'll see it was 932,000. the cost of opioids. Unfortunately, this is something we have to think about, and especially when we go to our legislators. This epidemic has already cost the economy in just 4 years $2.5 trillion. Um, our death rates in Arkansas were about almost 21 for every 100,000 Arkansans. And Arkansas is the second highest opioid prescribing state. Unfortunately, we kind of switch with some of our other southern states, with other things. One thing Arkansas is doing really good on is Narcan education and getting Narcan out there. We have seen a decrease in overdose deaths because people are getting Narcan and because they're getting trained on how to use it. And folks are saving people before first responders can even arrive. And so this is very impactful. So if you can carry Narcan on you, I highly, highly encourage everyone to do so. So we're going to go over just identifying opioid overdose signs and how to administer Narcan. So opioids, most people are pretty familiar. If we've had surgeries, I know when I had my wisdom teeth out, I had hydrocodone. Fentanyl was, used to be prescribed, and it still is prescribed, but for those, who were in some of the worst types of pain. So we saw a lot of terminal cancer patients taking fentanyl patches. We also have medication-assisted treatment that is meant to help people improve functioning, but also in a safe way wean off of opioids. And so we have things such as Subutex, Suboxone, methadone clinics, which you guys may be familiar with. But we also have synthetic opioids and illicit opioids, which include heroin, fentanyl. We also have something called carfentanil. And unfortunately, they just continue to make stronger and stronger types of opioids. And this is because they're very cheap to make, but very profitable to sell. So and opioids directly are going to act on the central nervous system. And so if you just think about all the different systems, your respiratory system, your brain function, your heart, and so forth, all of these things are getting, depressed during an overdose. And this is really why people who are using opioids are at risk for overdose. So this is a graphic. I took it from the DEA's website. This is all it would take of fentanyl to cause an overdose. And I put it next to a penny. You can see it's not much. And so just this amount alone can cause the initial signs of an overdose, including dizziness, nausea. It is so powerful, and it's very similar to the makeup of morphine, but is 50 to 100 times more potent. And that is dependent upon who makes it and what they mix it with. So people are mixing this with acetaminophen, maybe a household chemical powder of some sort. You never know exactly what the fentanyl is being mixed with. They just take a little bit of it, mix it, and they can make press pills. They can dust it or lace it in different things such as marijuana. It just doesn't take much. I mentioned carfentanil earlier. This is a stronger type of fentanyl that is being made, and it has a potency approximately 10,000 times that of morphine and 100 times that of fentanyl. So, we are seeing more of this. We definitely see a lot of fentanyl, but we're seeing carfentanil, and we're also seeing something called xylazine being mixed with these types of fentanyls. And xylazine is an animal tranquilizer. It's used to tranquilize very large animals like elephants. And now and once again, it's very cheap to make and mix with things. And so we're seeing this being mixed with fentanyl, which I'm sure you can imagine is just making things much more dangerous and much more deadly. So again, I love my graphics. I wanted to give an illustration of heroin, what it would take. You see in that first bottle, that is the amount of heroin it would take to cause an overdose. Then we look at the one in the middle, fentanyl. And just to show you how potent that carfentanil is, that little drop in there is enough to cause an overdose. So graphics pictures really help me to wrap my head around this, and I'm hoping that it helps you as well. These are press pills. I will just say I've seen even better press pills made, but I wanted to make sure that I did get ones that were from the crime lab. So I actually have clients. I had two 15-year-olds who thought they were buying Xanax bars off the street, and it turned out they were laced with fentanyl. Both had to be hospitalized. One is doing okay. The other one we're not so sure about. Some cognitive deficits that we're not sure if they will be improved or not. Very scary. Scared these two kids very much so. The ones that are pink or peach colored are fake Adderalls, which are very commonly purchased off the street. And then the bottom here, we have oxys, both real and counterfeit. All of these have been made with a sprinkle of fentanyl and then whatever other mixtures that they use to make them look legit so that they can sell them on the street for same price that they would sell regular pills or, non-laced pills. However, the profit is much bigger. And so we're seeing people purchase pill presses and just, makeshift labs in basements or buildings and making these. So Arkansas actually does not endorse test strips for fentanyl. And there's several reasons for that. They're actually illegal in Arkansas. And I really like this graphic because if I took a press pill and took something and just, crushed it, how do we know what parts contain fentanyl? So you could see there could be trace amounts of fentanyl in there that can be lethal. And being able to accurately use a test strip for this, it would not yield adequate results. And so the reason we don't want to endorse test strips for fentanyl is because very easily you can receive inadequate results that can be deadly. And so it's very important that we educate on this because, harm reduction is a wonderful thing. And there are some wonderful ways to test for different substances. However, the fentanyl test strips are not, they're not reliable. And it's just something we don't want people putting their life, life on the line for and to trust. So how do people become addicted? Well, as I said, I talked earlier, 20-ish years ago, I lost my cousin. I was also in nursing school during that time. And we learned, and by the way, I'm not a nurse. Glad I changed my major and found my passion. But we did learn during that time, and while I was working in the hospital, that we were to treat pain as the additional vital sign. And we treated pain until the patient reported no more pain. And also during this time, these, opioid medications were being marketed as safe, non-habit forming, non-addictive. So we learned over time that that was not the case. So, prescribers were acting on the best information that they had at the time. And naturally, people build tolerance to opioids. They connect or bind to our dopamine receptors, and our dopamine makes us feel good. And so people did not realize that they were becoming addicted and dependent on these opioids. Many times it starts just from using medication for existing pain. That medication may continue after the symptoms are gone. Trauma, stress, peer pressure, exposure, and lots of misinformation is out there. Trauma is the number one mental health issue associated with substance misuse and abuse. We really need to take that into consideration. People are trying to cope with things, and unless they have, support and healthier skills to cope, many times they may turn to things that they feel, they feel some relief. Also, deliberately misusing a prescription opioid or an illicit drug like heroin. Many times, especially young people, they have told me, in the work I've done over the years, I just go to grandma or to my parents or to so-and-so, someone they know, to their medicine cabinet. That's where I access a lot of stuff. So we really need to start thinking about this differently. Unfortunately, a lot of people got addicted just because they went to their doctors and trusted, the information that they were given. And it's great that, we're working on prescribing them less and looking for other treatments. But what about the people who are already addicted? This withdrawal is terrible, and we must do a better job of connecting people with treatment to help them maintain their recovery. So risk factors for overdose, this is both for intentional and unintentional. Mixing medications, as I talked earlier, people like to mix downers and uppers. That is very dangerous for so many organs in our body. Over medicating, the more you take, the more suppression is going to occur in that central nervous system. Misunderstanding the directions for prescribed opioids. We're only supposed to take them as needed, not, they're not meant to finish out our dose, kind of like we do with antibiotics, right? They're different. Mixing drugs, including with alcohol. These are both depressants. So when put together, it's very dangerous. Returning to use after taking a break because tolerance lowers. So we'll see people get in recovery and then have a relapse or a lapse, and they don't necessarily understand that their tolerance has decreased. So they may go back to the previous dose they were using, and their body just cannot tolerate it. And we see a lot of overdoses due to that as well. So identifying an opioid overdose. Inability to wake the person upon chest rubbing or good sternal rub, where we take our knuckles and rub, someone on the sternum. It sounds cruel and mean, but it is a really great way to get someone's attention and to get them conscious if they have that ability at all. Shallow or slowed breathing of less than 3 to 5 breaths per minute, or no breathing at all. Exhaled breath with a raspy, labored sound or snoring sound. So they're starting to struggle to move air, and they may start aspirating because all of these systems in their body that normally take care of those things are hindered at this moment. Fingernails or lips turning blue and purple, and speech will be slow. So what is Narcan? It is a drug. That has been around for decades. It is used to reverse the effects of opioids. It is safe and effective with no risk of abuse, which is a common myth. There's no risk of abuse with this. It's not going to make anyone feel good. It has no effect on non-opioid overdoses. So a lot of times, even in hospitals, it might be a standing order if someone comes in and they're unconscious and a substance is suspected, go ahead and give the Narcan. So if you have somebody who maybe they passed out from alcohol abuse and use, you could still give them Narcan and it's okay. Worst case scenario is probably just going to be a wet nose. So very important that you can go ahead and give it just in case. It cannot get you high, and it is intended for rescue use, not long-term treatment. Another common myth I hear is, oh, if we give out Narcan, it's going to encourage people to use. I heard the same argument when we started putting sharps containers in bathrooms, public bathrooms. This is a safety issue. This is about saving lives. This does not encourage people to use more. Um, you know, people who are truly addicted, they don't care about, if there's a sharps container. They don't care, if Narcan is around. The addiction is just so strong. So we really need to get away from these stigmas and start and kind of focus on, what's best for people, for our fellow person. So UCA, we were the first university in Arkansas to offer nalox boxes. This was our first one that we installed. It is next to the defibrillator in the ITC center. We have them in all of our residential halls, and it includes 2 doses of Narcan, a breathing mask, as well as cards that can give you access and resources for treatment, assistance, and so forth. We also have one in the library and the student center. And so if there is a defibrillator in the building, you will find it next to the defibrillator. If there is not a defibrillator in the building, we try to put them next to the fire extinguishers or the mailboxes, so that more people can access it. So how naloxone works, what happens is it basically goes in and it's going to kick the opioid from the brain receptor, and it's going to plant itself and block the opioid from reattaching. So I really want this to be a focus. I'm going to say it a couple times. Narcan works for about 30 to 90 minutes. Opioids stay in the body much longer. The first thing you should do when you suspect an overdose is to call 911 and get medical assistance on their way. And that is because you only have a 30 to 90-minute window, depending on how much they took and their metabolism and all these different factors. So very, very important to make sure that you have help on the way prior to giving naloxone. So they're strongly, if you give naloxone or Narcan, you really need to encourage the person to go to the hospital after being revived. And this is, as I said, Narcan stays in the body for 30 to 90 minutes. And because opioids stay in the body much longer, a person can go right back into an overdose. So our former drug director and now director for the Arkansas Opioid Recovery Partnership was in an airport, and a man just passed out. And upon his assessment, he realized we have an overdose. So he administers Narcan. The man becomes conscious, but of course he's freaked out. I don't know if any of you have ever passed out, but it's very scary. I have. And, when you are alert, you're like, what the heck happened? Why are people standing around me? It's scary. So he very calmly stayed next to the man, explained to him what happened. The man was taking his prescription opioid medication, and for whatever reason, I don't know what the other factors were, but had an overdose. He was worried about getting to his flight on time, which, is pretty common when we're traveling. But luckily, Kirk Lane was able to say, I really encourage you to wait on medical treatment, because once this Narcan wears off, you can go right back into an overdose. And we definitely don't want someone on an airplane without access to medical care. And so this is so important that we know this, and we can get people the help that they need to save their life. So there are side effects of Narcan reversal. The person's probably going to feel a little irritable, nervous, feel restless. They may have some body aches, feel dizzy or weak. Stomach pain, nausea, diarrhea are normal side effects. Fever, chills, or goosebumps, sneezing or runny nose without a cold being present. vomiting may occur. And so you're definitely going to want to put the person in a rescue position. And some individuals may become combative. We don't know if a person, has been through a traumatic experience and may become conscious and scared. That is a very real thing. Some people are so far in their addiction that they may be angry. You took my high away, because they're just not in the space right now to realize that they could have died. And so keep yourself safe, but also try to be a very calming presence for people when they are regaining consciousness. We ask that everyone download the Narcan app. This is available for Androids and iPhones. It's just really cool resource. So if you are ever in a situation where this occurs and you're like, oh, I had the training, but I'm panicked, and we forget things when we're panicked. Well, you can pull up this app, hit rescue now, the type of Narcan you will be using. We give out this nasal Narcan, which is the top one. So you would click that one. And then it has instructions in both English and Spanish that you can play. And it walks you through what to do in an overdose. It also allows you to anonymously report that you use Narcan and save someone's life. It allows you to find places if someone wants to go to treatment. It connects you with people. It shows you places you can turn in prescription drugs that don't need to go into our waste systems. There are so many resources on this wonderful app, and other states are following suit and doing a lot of these similar things. So I encourage everyone to download this. So steps for Narcan administration. As I said earlier, we're going to do a sternal rub with our knuckles, see if we can't get them, conscious or any kind of response. We're going to call 911. Again, we call 911 first because naloxone will only stay in the body for 30 to 90 minutes. We're going to administer the naloxone. So you're going to take your spray and you're going to give a good, swift plunge. Someone said, shoot for the brain, just really get it up there. You're going to perform rescue breathing, place in recovery position if breathing, and then monitor the response. And we're going to go over these steps in a little bit more detail. I want to first talk about the Joshua Ashley Pauley Act. Really trying to spread awareness and messaging. Don't run call 911. Josh, his mother, Kimberly Ashley Pauley, actually works at UCA. She is an amazing person who assisted with getting this wonderful law passed. Her son was a student at UCA, a very good student. He was partying with some friends and had an overdose. The people he was with panicked because they were all using, and rather than calling 911 for assistance, I think they tried to do some, see what they could do. And when they realized that he was, not responding, they took him to the hospital, basically dropped him off and took off. And Josh, unfortunately, passed away. So this law protects you if you are using with someone and they start to overdose, or if you're present when someone's using and they start to overdose and you call 911, you have protection with this law. I wish this law would have been around when my cousin passed away. They tried, his friends did a lot of things to try to save him. Unfortunately, none of those things worked, and they prolonged calling 911, and he lost his life. The law does not apply. It does not provide protection if anyone present has outstanding warrants and if there are other substances there. So I suggest that those things not be present, or if people have warrants, if at all possible, they not be present when first responders arrive, because we want this law to help save people, but we want you to have the facts at the same time. So, those are the two distinguishers. There is also a specific opioid no liability law that was passed in 2015. Bystanders and first responders can administer naloxone with zero liability. So I get a lot like, oh, am I going to be sued if I administer this? No, you are protected by law. And this is in cases of suspected overdoses as well. So the Narcan that we give out at UCA and that the Arkansas Opioid Recovery Partnership gives out is the nasal kind. So it comes in a blister packaging. You get 2 of these per box. You pull the blister packaging off. The nozzle's at the top, and there's your plunger. Put it in their nostril and administer the full dose. Some people are going to need rescue breathing. So we want to make sure that we check that the person's airway is clear. Place one hand on the person's chin, tilt their head to ensure the airway is open. Pinch the nose closed. Place your mouth over the person's mouth to make a seal and give 2 slow breaths. The person's chest should rise, not their stomach. And we want to follow up with 1 breath every 5 seconds until the person can breathe on their own. This is the recovery position that I mentioned earlier. It helps keep the airway open, and this should only be done if the person is breathing. You notice that the hand goes under the head, the top leg gets bent out to support their body from turning over, and their arm is out to prevent them from turning over. This is very important to do because the person may vomit, and we don't want them to aspirate. And so this helps to keep their airway open. After administering naloxone, stay with the person until help arrives in case a second dose is needed to revive them. This is the case sometimes. You'll want to administer the second dose if the person does not respond after 3 to 5 minutes when you're doing your rescue breathing and you've given them that first dose. I recommend giving the second dose in the other nostril just in case there was an occlusion. Continue rescue breathing, and when the person is alert, remember, be very calm, soothing, explain what happened and that you gave them Narcan. Let them know help is on the way. If they're wanting to take more drugs or leave, explain to them, why it's important to go get assistance. And wash your face and hands with warm soapy water just in case you came into contact with any of the opioids. And I also recommend using a face shield if at all possible. I purchased some very cheap, just the plastic ones that I can just tape on to my Narcan. But there's all kinds that you can get. You can even get ones that go on your keychain, just for that extra level of protection for yourself. These are things you want to avoid doing. These are things that were done to my cousin, and these are myths. Slapping the person to try to wake them up. This can really hurt someone, especially when they're unconscious. Putting them in cold water, we're actually increasing the risk of them falling, drowning, and or going into shock. Injecting fluids. There's a lot of myths that you can use salt water, give someone milk, inject them with speed, heroin. None of these things will help. They can actually worsen the situation, and they really just waste time. Inducing vomit. We see this in the movies, right? Oh, make them throw up and, get it out of their system. If they are already in an active overdose, this is actually less likely to help them, and they're more likely to choke or aspirate on the vomit if you try any of these things. So reviewing the steps: stimulate by rubbing the person's sternum with your knuckles, call 911, administer the Narcan if available, perform rescue breathing, If they start breathing again, put them in the recovery position and monitor their response. As I said earlier, you can easily and anonymously report that you use naloxone. This really can assist with continuing to get the resources that we need, including free Narcan to give out, treatment, and so forth. Storing Narcan. We have very hot summers in Arkansas. And so we really want to try to keep Narcan in an easy to access place. I keep mine in my purse, and I also have some just in random places. And we want to, you don't want to keep it in your car, right? When we have a hot summer, cold winter. We want to try to keep it at room temperature, keep it in the original blister packaging, and watch the expiration date on the package. If in doubt, still give the Narcan. If it's all you have, the potency may still be enough to help the person. But these are just suggestions to keep the Narcan in good condition. Narcan access. There has been a law that has passed. The FDA has approved for Narcan to be sold over the counter. It can run from 45-ish up to 90-ish dollars. But there are so many places now that give it away for free, and that's due to our opioid settlement dollars. And Arkansas Opioid Recovery Partnership, they have folks all over the state who are giving free Narcan away, as well as doing the training. And sometimes insurance companies will cover it at no cost if the person is prescribed opioids. So resources. We have a wonderful Arkansas Drug Take Back program. The University of Central Arkansas PED actually has a box. No questions asked. You can go there and properly dispose of not just opioids, but other medications that really don't need to end up in our sewer and trash systems. Trace amounts of these things can still be harmful. And so it's always, safe if you're not taking these medications to dispose safely. There are two big events that occur each year, and they have educational things going on, as well as, free resources. And you could see they collected a little over 28,000 pounds in 2021. So that concludes this presentation. And I hope someone can be the hero. Please spread this information and messaging. Don't run, call 911. If you would be so inclined to do so, you can complete this survey. It just asks how kind of your perceptions on offering Narcan at our university. And this is my email address if you have any questions, or if you take this training and you're nearby UCA and you would like some Narcan. If you complete the survey, and you can provide me with the information I need, I would love to get Narcan in your hands for you to keep on your person, because you never know. But with that concludes this presentation, and I very much appreciate your time.